of the common nutritional diseases or what we face in case of goats and sheep, I will just name here, like polyancephalomalacia, pregnancy toxemia, white muscle disease, urolithiasis, hypocalcemia, enterotoxemia, copper deficiency, acidosis, and bloat. These diseases I'm going to discuss in brief in today's presentation. Other than that, some very important diseases like congenital goiter, copper toxicity, as well as reproductive disorders, they are also there, but due to paucity of time, I have chosen these topics only. So coming forward to the first disease which I'm going to discuss, that is polyancephalomalacia. From the name polyancephalomalacia, which itself stands like softening or necrosis of the gray matter of the brain is there in case of polyancephalomalacia. So how it is happening and what is the culprit for that? So it is one of the very important neurological disease in case of ruminants, specifically when we talk about goats and sheep. More important in case of goats. Why I'm telling that? Because what I have experienced, like in more in drought prone areas where animals like sheep, goat are more rare by the owners. So these goats, due to their browsing nature, they will leave the animals for browsing in the fields or in the wild areas. So while jujube, or what we call wild bear, what I have seen in many cases, they will browse on that, and owner is not having any history, like what happened to the animal, what animal has consumed, and we will only come to know when we will see the signs of the disease. So animal which are on a high concentrate diet, like similarly bear is also high, it is having high concentration of carbohydrates. So they are a rich source of carbohydrates, and they will put the animals to a higher risk of disease. Mainly two types of dietary risks are there for polyancephalomalacia. First one is altered thiamine status, and second one is a high sulfur intake in the feed or diet of the animal. So how altered thiamine status is going to affect? Like if we are having high grain diet which we are feeding to our animals, what happens? That will contain high starch content and less neutral degenerated fiber or NDF. So what will happen when these carbohydrates are broken down by the bacteria, or bacterial degradation is there? They will produce volatile fatty acids, and ultimately they will lead to the production of pyruvate. So for the conversion of pyruvate into the acetyl coenzyme, which is then utilized in Krebs cycle for the production of energy, we will require TPP, that is a thiamine pyrophosphate, which will act as a cofactor for the production of acetyl coenzyme. But when animals will consume excess of high carbohydrate rich diet, so pyruvate, due to less availability of the thiamine, there will be conversion of excess of pyruvate into the lactic acid or lactate, and which will ultimately lead to the decreased concentration of thiamine, and which will disrupt the energy production in the nerve cells and damage the brain cells. So this is about thiamine, like how thiamine is going to affect. On the other hand, when we talk about sulfate, like how sulfur containing drinking water or feed ingredients or forages which are having excess of sulfur, how they will affect? What happens actually? Thiamine producing microbes which are present in the normal as a normal microflora of the rumen, they will also reduce the sulfur into sick form, like hydrogen sulfide is produced, and this hydrogen sulfide will interfere with oxygen transport in the and function of the brain, ultimately leading the polyancephalomalacia. In the given picture also we can see dietary sulfate will go into the rumen, and in ruminal fluid it will lead to the production of hydrogen sulfide. So 60% of that hydrogen sulfide will be inhaled by the ruminants while they will eructate the gas, and it will lead to damaging the brain cells. Byproducts of corn and sugarcane industry, they are fed to the animals. Similarly, they will also lead to the sulfur excess in food and leading to polyancephalomalacia in the affected animals. So in the affected animals, what we can see, if acute cases like if animal has consumed a lot of thiaminase producing the forages which will lead to deficiency of thiamine or excess of sulfur is there, signs will be like in acute cases there can be a bloat, excess bloat can be there due to sometimes acidosis. Partial or complete blindness will develop when CNS will be affected, and unilateral ear droop as well as ataxia. Animal will not be able to maintain the balance in hind limbs. Recumbency tonic-clonic seizures, which is followed by death, coma as well as death of the animals in acute cases. But in subacute cases, the animals will generally separate from the group. They will stop eating, and gradually their ears and face will also show signs of twitching. There can be nystagmus or dorsomedial strabismus can also be there, head pressing, recumbency, all these signs varying on the concentration, like how much animal has consumed. Coming to the lesions, if in dead animals we are going to perform post-mortem, so we will see like acutely affected patients may have brain swelling or gyral flattening. Means gyri and sulci, there will be no difference in that, as well as there will be herniation of the cerebellum in the foramen and magnum can be there. If histopathology is performed, then we can see changes like cerebrocortical neurons will be having necrosis. So these will be the post-mortem changes. Coming to diagnosis, like how we are going to diagnose. First is presumptive diagnosis we can make on the basis of clinical signs as well as response to thiamine administration. Clinical signs, like if animal is having bloat, we are suspecting acidosis, a stargazing posture or nystagmus, strabismus, these signs are there, and there is history, like animal was left somewhere for grazing, or there is excess of carbohydrate which has been fed to the animal, so we can suspect somewhere. And if we are giving thiamine, animal is responding to that, so we can make a presumptive diagnosis like, okay, animal is having polyencephalomalacia. And definitive, obviously, we can do only based on the postmortem findings. Some important differentials for this disease like pregnancy toxemia, listeriosis, acute lead poisoning, salt toxicosis, vitamin A deficiency. In vitamin A deficiency also blindness will be there, but there will be loss of both pupillary light reflex as well as other reflexes will also be absent. But when we talk about polyencephalomalacia, the animal will be having no Meniere's reflex, but pupillary light reflex will be intact in case of polyencephalomalacia. So on that basis, we can differentiate that. Other differentiation like rabies, scrapie, we should also keep those in mind. Coming to the treatment, primary treatment, if we are having separate thiamine presentation, so we should go for that, like Beribin is there at the dose rate of 10 mg per kg body weight. Initially, we should give it IV or IM in initial dose, and after every 6 to 8 hours, we can repeat it by IM or subcut for following 3 to 5 days. And along with that, supportive care depending on the condition of the animal. If animal is having more pronounced CNS signs, so we are suspecting cerebral edema, we can go for 20% mannitol. Dexamethasone we can give, and if convulsions are there, then we can go for diazepam at 0.5 to 1 mg per kg body weight IV. Dietary investigations and modifications are necessary, like what animal has consumed, if it was left for grazing, what kind of means plants or bushes are mainly present in that area. We can have some idea from that. Sufficient roughage should be provided to animals to promote rumination, ruminal production of thiamine. Because if we are giving only concentrate, so if when animal is consuming concentrate, they will not produce excess of means good amount of saliva, and they will not give much time for the process of rumination or ruminal functioning, so microbes will not be working properly. But if roughage is there, so ruminal microbes will get proper time and they will lead to the production of thiamine in the rumen. Coming to the second disease, that is pregnancy toxemia in case of sheep and goats, and we also call that ketosis, fatty liver disease, or twin lamb disease. So what actually happens in this disease? This is mainly a metabolic disorder, but we can consider it under nutritional diseases also, because there is an imbalance of diseases. Like nutritional diseases can be due to deficiency, imbalance, or special needs of the animals. So in this case, it is a metabolic metabolic disorder, which generally affects the animals in late gestation or early early postpartum period, and it is mainly due to negative energy balance, which can be due to inadequate nutrition or any kind of stress to the animals, like inclement weather is there, or transportation stress is there. So in that case, it will occur in last few days of gestation, mainly in last 4 weeks of gestation, or after early postpartum period. Because in late gestation period, the fetus will be having high demand of energy. For example, the animals which are having 2 or more fetuses, they will be affected more, because it is said that in late gestation 30 to 40 gram of glucose will be required by one fetus per day. So in that case, what the animal will do, they will go into the process of gluconeogenesis, and fat stores from the body will be mobilized. The animals which are having poor body condition score, like who are very thin or who are very thick, they are more affected at that time, because when excess of fat stores are mobilized, the liver will be overwhelmed it will go out of its capacity, and it will lead to the production of ketone bodies. So this is picture depicting the pathogenesis, like what is happening. Like for example, feed intake does not meet the energy demands of the doe or the mother. Then insufficient ruminal production of propionic acid, which is the precursor of glucose. Ultimately, the animal will go into a stage of hypoglycemia, and due to that hypoglycemic stage, the low blood sugar will metabolize fatty acids from the body. Ultimately, the glycerol will be oxidized to form acetyl coenzyme A, and excess of acetyl coenzyme A will be converted into ketone bodies, because lack of energy, sufficient energy is not present, or TPP is not available in the body. So in ketosis will be there, and ketone bodies will accumulate in excess in milk as well as in urine. In ketosis, what happens, like bicarbonate levels will usually decrease in the blood of the animal or in the body, because ketone bodies like acetoacetic acid or beta hydroxybutyric acid, they are acidic in nature, they are acids. So when hydrogen ion will build up in the body, they will bind to the bicarbonates in the body or in the blood, which will lead to the drop of bicarbonates in the serum, and ultimately there will be drop in the pH of the blood, or acidemia will be developing in the affected animals. In those affected animals, the clinical findings, they can develop 1 to 3 weeks before parturition or even after parturition also. Selective anorexia will be initially seen. Selective anorexia means initially animal will be taking the roughages, but it will not like to take concentrate. So it will be followed by recumbency, listlessness, muscle twitching can also be seen, grinding of teeth, head pressing, and in terminal stages there will be coma and followed by death. So cerebral hypoglycemia, along with ketoacidosis can develop, and reduced hepatic and renal function will be there, leading to the fetal death. So glucose levels in the blood can come to normal in the terminal stages. Mostly it is seen when the fetus inside the mother has already died. So automatically the glucose level will return to the normal in those animals where fetus have already died inside the womb. How we are going to diagnose these cases of ketosis or pregnancy toxemia, like based on history and clinical signs. History means what is the stage of gestation when animal is going to deliver, or if we are knowing like animal is carrying 2 fetuses or triplets are there. In those cases, clinical signs like head pressing or other signs like animal is lethargic, not taking food, or selective anorexia is there. So in that stage, we can suspect smell of breath, which is a sweet smelling breath or a sweet acetone smell is there. Lab findings like hypoglycemia is there in those cases, or increased urine ketone concentrations. We can check on dipstick method. We can check if high ketone concentration is there, or we can also utilize the potable method of ketone testing, like ketone strips are there, and like we are checking glucose in home, we can check ketone bodies also. For differential diagnosis, we can differentiate with polyancephalomalacia, hypocalcemia, toxic mastitis, grain overload, listeriosis, and lead poisoning. So, coming to the treatment, how we are going to treat the cases. So, in early stages, we can either go for IV or subcut glucose. If high concentration 10% or 25% glucose we are giving, then we can give IV. And followed by early stages, we can go for propylene glycol, like oral therapy we can do 60 ml per orally every 12 hours for 3 days, or 100 ml per day we can go for that, which is followed by oral supplementation with calcium and potassium if it is needed, if animal is not able to get up. So in that cases, and protamine zinc insulin also we can give. Like in some cases, in large animals also we try to give protamine zinc insulin. So, and we were getting good results in those cases. So in goats and sheep also we can give that, because this insulin will help in the utilization of glucose by the cells of the body, and increased chances of survival will be there in such cases. If dehydration is more, so to combat dehydration and acid-base imbalance, we can give commercial electrolyte solutions. Like orally also, we can give Balance Sol, Brimtose, Intalite. All these solutions are available. We can give that. And to combat the acidemia, we can give 5% sodium bicarbonate, which can be followed by isotonic bicarbonate solution. And to reduce increased demand for glucose, it is ideal to go for cesarean section or induction of parturition, specifically those animals which are carrying duplets or triplets. In those cases, we can go for emergency C-section also. So this is all about this, and how we are going to prevent an adequate nutritional level throughout pregnancy. If we will maintain, then we can prevent pregnancy toxemia. And specifically, we should give more attention to the animals which are carrying twins or triplets. And body condition scoring, like we should maintain animals' body score in between 2 to 4. Animals who are having score 1 and who are having score 5, they are more prone to the development of pregnancy toxemia. Coming to the next disease, which is Clostridium perfringens type D enterotoxemia, commonly known as pulpy kidney disease or overeating disease. So, as the name suggests, overeating disease. So, this disease is mostly seen in animals which are in good health or good condition. So, those animals, when they are provided with lush pastures, sometimes they will overeat on highly nutritious diets. So, this disease is mostly seen in lambs which are between 3 to 10 weeks of age, and ewes which are on lush pastures. Mainly, there is production of epsilon toxin, which is a very important toxin, and that can damage the vascular as well as nervous system, leading to the production of the CNS signs, as well as its name is pulpy kidney disease. Normally, what happens, whatever feed is consumed by the animals, there are some amount of bacteria that is ingested along with that. Normally, that bacteria is destroyed in the rumen or abomasum, and only a few will reach up to the duodenum. But what will happen in case of overeating? There will be large number of starch granules, which will slow down the alimentary tract. If alimentary tract is slowing down, means rumination will be slow, and there will be more time for the bacteria for the multiplication and production of the toxins. So when excess of toxins are produced, they will be absorbed into the blood, leading to toxemia, and they will show their signs by damaging the blood vessels. Like vascular damage will be there, and they will increase the permeability of the blood vessels. And similarly, in brain also, they will damage the brain vascular endothelium, which will lead to the production of nervous signs in case of pulpy kidney disease. And along with that, protein-rich effusions will be in brain, heart, lungs, like major organs will be affected with that. Like fluid will be there if we will see on postmortem. And the typical name which has been given to it, like pulpy kidney, that is due to rapid postmortem autolysis of the kidney tissue. That's why the common name is used. Clinical findings, like in lambs, there will be depression, some facial movements, a loss of interest in feed, convulsions, frothing at mouth. These will be some of the signs in lambs. In adult sheep, The sheep will initially lag behind the flock. They will be champing of jaw, salivation, irregular respiration. In goats, particularly in young kids, there will be paracute form, like high fever can be there, convulsions, and abdominal pain, dysentery, followed by death. And in adults, acute form is there, but there is no fever. Diarrhea and abdominal pain is predominantly present in case of goats. And on postmortem, we can see like straw colored fluid will be present in pericardial thoracic cavities, and which will clot on exposure to air when we will cut open the cavities. Patchy congestion in abomasum and intestinal mucosa will be there, and pulpy kidneys, as the name suggests, due to rapid autolysis of the kidneys within few hours of death. And symmetrical areas of hemorrhages, edema, and liquefaction of brain due to the damage of vascular endothelium of the brain will be there, which will lead to the production of CNS signs. Important differentials for this disease are acute pasteurellosis, polyencephalomalacia, rumen overload, hypomagnesemia, and lead poisoning. Because somewhere in these diseases also there will be production of nervous signs. So we should keep these important diseases in differentials. Coming to the treatment, if we are having hyperimmune serum available with us, so we can go for that. In goats, the course of the disease treatment is longer, and antitoxin, if we are giving, that should be combined with orally administered sulfadimidine. Sulfadimidine usually we can give here at the dose rate of 1 gram per 10 kg body weight. We can give sulfadimidine in these cases. And after treatment, coming to the prevention, because prevention is most important in such cases, because if paracute or acute disease is there, we can't do anything with treatment. So control is more important. So we should not give excess of food to the animals, like good nutritious food. We should not let them to eat ad libitum. There should be some management, like we should control the animals. Epsilon antitoxin, if we are having, we can give 200 IU per kg body weight. And vaccination, that is very important, like Raksha ET, Raksha enterotoxemia, that is a vaccine prepared by IAL, that is available. And we can start dosing, vaccinating the animals with primary vaccination at 4 months of age. After that, revaccination can be done annually with 2 ml subcut in the neck area of the animals. Moving forward, after enterotoxemia, one important disease is urolithiasis. So, urolithiasis, mostly in case of sheep and goat, it is very important disease, mainly in the male animals. Male animals, it is not the thing like females are not suffering. Disease is equally prevalent in males and females, but since urethra in case of male animals is narrow, sigmoid flexure is present, and vermiform appendage is present in case of male urethral system. So that's why they are more prone to the obstructive urolithiasis. And urolithiasis cases are more in the time of like winter time, it is more, or when there is insufficient water intake or insufficient availability of water. Like for example, some animals which are in pastures, if there is not proper availability of water, so those animals can suffer with urolithiasis more. And it is more reported in months of winter months, because in winters animals also tend to have less consumption of water. So that's why. And when there is urine pH changes due to some infections, like when we talk about struvite urolithiasis, so there is involvement of some bacterial infection, mostly in struvite urolithiasis. So that can lead to the change of pH, and that can lead to formation of uroliths. So, urolithiasis presence of stones or calculi in urinary system, and most commonly in case of small ruminants, calcium hydrogen phosphate dihydrate and struvite uroliths are more common. And diets which are high in grain, phosphorus, magnesium, and which are low in roughage, they will put the animals on more risk of formation of phosphate urolith. Why I'm telling like less roughage? Because when roughage consumption is there, it will lead to production of saliva, and through saliva also in ruminants, there is excretion of phosphate from the body. So those animals which are mainly fed on the concentrate diet, so there is less production of saliva, and that's why those animals are also on the increased risk. They are more prone to the development of urolithiasis. So coming to the pathogenesis, like due to any reason, like less consumption of water or due to anatomical defects, like male animals which are castrated early at the means at the early age. Normally, what people will do, like from starting from the 3 days to 3 weeks, they will castrate the male animals at the early age. But at that time, the urethra has not developed, like a diameter of urethra is not properly increased. So there are high chances of those animals, they will suffer with urolithiasis when they will become adult. So it is advised like animals should be castrated at later stage of life when due to action of testosterone, their diameter of urethra has increased. So they can easily pass the uroliths if they are formed. So when there is urinary supersaturation, that will, like for example, hyperoxaluria is there, and it will lead to the oxidative stress and cell injury, like membrane of the cells will be injured, like where these uroliths will start forming. It will lead to nucleation and crystal growth. Nucleation means it will start as a bud. Over that, like over those damaged cells, they will give a nidus. Over that, slowly, due to supersaturation, all the minerals will accumulate. Crystal aggregation will be there, which will lead to crystal cell interaction, crystal retention, and stone formation will result. So diets which are too high in phosphorus, urine phosphorus levels will become excessively high. Phosphorus will settle and consolidate into formation of stone forms. And in these animals, clinical signs mostly due to obstructive urolithiasis, because normally if animal they are having uroliths, but if they are passing through the urethra, we will not come to know like animal is suffering with urolithiasis. But mainly signs will be seen when there is obstruction. So early clinical signs like hematuria, straining to urinate, a decreased production of urine, maybe due to obstruction of urethra, painful urination, prolonged micturition, dribbling of urine, tail flagging, abdominal pain, like we can say animal is kicking at the belly, rolling from side to side, or looking at the belly. So we can have idea like something is wrong with the animal, and the animal is having some pain, some kind of pain it is showing. In late signs, if we are ignoring these early signs or we are not reaching up to the diagnosis, like what can be there? So there will be loss of appetite, apparent depression will be there, abdominal swelling, particularly when there is rupture of bladder due to blockade of urethra, and swelling around the prepuce or in the skin covering the penis can be there. Once the animal is severely ill, it may lie on the sides and not be able to get up, and it can eventually die. Coming to the diagnosis, how we can diagnose urolithiasis in sheep and goat. Like initially, there will be increased heart rate and rapid breathing in the affected animals. Possibly, there can be a large bladder which we can palpate with show resentment, like they will feel some pain when we will try to touch their bladder. And if urinary bladder will rupture, then suddenly we can feel like if it was enlarged, it will shrink, and a fluid wave we can see in the abdomen. Like when we'll do ballotment or we will do the percussion of the abdomen, we can feel a fluid wave. And if uroliths are trapped in the urethral process, then if we are touching the urethral process, we can feel it. When we are doing the blood biochemistry, we can see high blood urea nitrogen, creatinine, and potassium will also be high in those cases. Potassium is not high due to urolithiasis, but due to any affection of the kidney. Particularly in this case, because potassium is excreted by the kidney when urine production is less or urine is not excreted, in those cases, potassium can become high. On ultrasonography and radiography, depending on the type of urolith present, like those are having high calcium content, they will be easily seen on radiographs. And urine sediment microscopic examination we can do. Like if we are seeing in this picture, we will collect the urine, we will centrifuge the sediment we will discard the supernatant, and on this microscopic slide we will put that sediment, and putting a cover slip we can examine like what kind of crystals are present. Mainly two type of crystals are seen in case of sheep and goat. Like if it is wedge shaped or rectangular shaped, if we can see like calcium phosphate crystals we can see, or if it is struvite crystal like envelope type, we can see like rectangular envelope type crystals. If it is present, then we can find out like it is the struvite crystals. As I told, like struvite crystals, maybe there is some etiology of infectious region, so in those cases we will have to go for proper antibiotic also. Coming to treatment, like if obstructive urolithiasis is there, so depending on the location of obstruction, we will go for surgical techniques. Like if it is present in vermiform appendage, as shown in the picture, we can go for amputation of vermiform appendage. If it is in the urinary bladder, then tubecystotomy we can do. We can remove those uroliths, and we can put a catheter, tube cystotomy. Urinary bladder marsupialization is also performed. Erythrotomy, if it is stuck in urethra. Perineal and high or low and prescrotal erythrostomy can also be done, depending on the location where it is localized. So prevention is always better than cure in case of urolithiasis when we are talking about urolithiasis, because uh, sometimes if obstructive urolithiasis is there, only surgery is the last option with us. So we can, if we can prevent the disease, that is more important. So we can add salt content to the diets. Like gradually we can increase, like normally we will put 1%. So gradually we can go up to 3 to 5% to promote more water intake. Ammonium chloride can be fed at a level of 0.5 to 1% in dry matter in the diet of the normal animals. Like there are some pictures of ammonium chloride which is used in case of ruminants, or we can give to the animals. Or normally also we are having packets of 150 or 200 grams of ammonium chloride, or tablets are also available. We can give that. Frequent or ad libitum feeding should be done in animals to reduce the urine concentration. Because why it is important to give ad libitum feeding in the affected animals, because when frequent feeding is done, then in those cases, and the surge of volatile fatty acids will be less. Like for example, those animals which are given on a perfect timing only, they're giving the meal, during that time there will be high surge of ruminal volatile fatty acids, which will exert an osmotic pull. Like due to that pull, extracellular fluid will give water, and as a result antidiuretic hormone is released in the body in a response to water loss from extracellular fluid. So what will happen? It will lead to the urine concentration when antidiuretic hormone is released, and it will increase the chances of calculogenesis. So it is advised, like if it is possible, then we should go for frequent and ad libitum feeding of the animals in place of meal feeding to reduce the chances of urolithiasis. And late castration should be practiced in animals. Like for example, if it is possible, then after 4 months, ideally it is after 6 months, but if we can't wait for 6 months, so at least for 4 months we should wait before castrating the male animals. Coming to the next disease, which is parturient paresis in sheep and goat, also known as hypocalcemia, milk fever, or lambing sickness. This disease is also more seen in case of animals which are having twin or triplets. So what actually happens, like how calcium is homeostasis is maintained in the body. When there is less calcium in the body, then at that time parathyroid hormone is released, which will act on kidney as well as intestine, and it will increase the reabsorption of calcium from the body. So, and when there is excess of calcium, so calcitonin is released at that time to reduce the absorption of or resorption of calcium from the body. So when there is a decreased calcium intake under conditions or during late gestation, when there is high requirement of calcium, the disease can occur, and it is mostly seen 6 weeks before to 10 weeks after parturition. Normally, what happens as the body requires 24 to 72 hours, like 1 to 3 days for activation of the metabolism to release or activate the calcium stores from the body. So older dams are more affected in that case because older animals are having less absorption of calcium, or it is slow from the body, like their intestine, their kidney, it will function slowly. And on the other hand, their body will take more time for the activation of this process. Like normally it is 1 to 3 days, but their body will take more prolonged time. So old animals are affected more in this case. And the animals which are having concurrent pregnancy toxemia, those are also more affected in this with this disease. Clinical findings, like what will happen to the animals. Initially, within 24 hours, there is an abrupt feed change, or whether inclement weather is there, short period of fasting or shearing, transportation, particularly in pregnant animals. So and they can develop early hypocalcemia signs, like the animals can be hyperexcited, or there can be salivation, ataxia, depressed ruminal motility, leading to bloat, recumbency, as well as death. And after some time, animals can develop a sternal frog type position with the hind legs extended caudally towards the backside. If hypocalcemia is present along with hypomagnesemia, then in that both fore and hind limbs will be affected, which will show tetany or stiffness, hyperesthesia, recumbency, as well as convulsions will also be present if hypomagnesemia is also present with hypocalcemia. So coming to the diagnosis, although Sulcovich test is there for diagnosis of calcium, but it is said that is not that much appropriate in such conditions. So we can go for blood samples, and those animals are having low calcium concentration in their blood, we can go for the treatment. Like hypocalcemia, if it is the concentration of less than 2 millimoles per liter, then or it is expressed as less than ionized calcium less than 1.1 millimole per liter, then we have to go for treatment of the affected animals. In lab confirmation, we will require only 2 ml of serum, which can be submitted in chilled form for calcium as well as magnesium estimation. Coming to the treatment, first line of treatment is better. We should go for calcium borogluconate, because if we are having calcium borogluconate, so calcium magnesium borogluconate. So in those cases, if hypomagnesemia is also suspected or is also present, that will combat both the diseases. So we can easily give 50 to 150 ml of slow IV. It is better to give with 5% dextrose mixed with that, and along with that, we have to auscultate the heart. So we have to give it but slow only, like drop wise we can give, and followed by that we can give oral or subcut calcium. Like it is said that it is better to give 1/3 of the required calcium dose initially IV, and rest we can give by subcut route. Orally, if we want to give, like we can give calop gel is present or himcal gel is present, that we can give to prevent the relapse of the condition. Dietary modification we can do, like for example, we can increase the ratio of calcium phosphorus 1:5 to 1 ratio. We can put the limestone to the grain diet, and we can feed roughage as we can say hay, chaff, and pellets in high, which are high in fiber. Why we are saying like we should feed more roughage? When animal is consuming more roughage, animal will give more time for rumination. So when rumination process will take time, so it will give us more time for the absorption of calcium from the body. So that's why it is better to feed roughage also in more quantity. Next disease is white muscle disease, which is also known as nutritional muscular dystrophy or nutritional myopathy. Nutritional diseases, mostly the culprit for this disease is vitamin E as well as selenium. As we know, vitamin E and selenium, these are important antioxidants. Like selenium is cofactor of very important antioxidant enzymes. So in those cases, when vitamin E or selenium are deficient, so animals will show some changes, particularly their muscles will be showing degeneration. It is most commonly seen in newborns or the animals which are growing fast, because they will be having more requirement of these antioxidants in the body. And selenium deficiency is more pronounced in the forages which are grown on soils which are already deficient in selenium. But vitamin E deficiency is not dependent on soil. Mainly vitamin E deficiencies will be seen when we are feeding some stored feeds which are old, like 2 3 months old feed we are giving to the animals, which will reduce the vitamin E levels up to 50%. So we should be careful with that, like that feed should not be stored for a prolonged time. And clinical findings, if such affection we will see, like we can see in the picture also, like mostly skeletal and cardiac muscles will be affected. In skeletal muscles, as we can see the lamb in this picture, there it is showing some mild stiffness, and obviously this animal will be having difficulty in walking. So affected animals will eventually become weak, because they will be, their food intake will be good, but as the muscles will be affected, slowly they will be becoming weak only, and the point will come when it will become difficult for them to go for their feed or to nurse. If the disease affects heart, so in those cases animals will show signs like pneumonia, difficulty in breathing, nasal discharge, and a high fever can be there. And in adults there can be poor conception rates, abortion, retained placentas, and they can deliver weak or dead lambs or kids. Coming to diagnosis, we can measure selenium levels in whole blood as well as tissues. And here we can see in this picture, like white in the affected muscles, white foci of fibrosis can be seen, followed by red inflammation, which is evident in the hind limb muscles in this particular picture. And here in heart muscles, we can see normally heart muscles are reddish in color, but fish flesh like white muscles are present in the heart of affected animals. So these affected muscles will appear paler as compared to the normal muscles. Coming to the treatment, like we are having various preparations in the affected animals. If skeletal muscles are affected, we can give selenium vitamin E preparations at the dose rate of 1 mg of selenium per 18 kg of body weight, which can be given subcutaneously as well as intramuscularly. But when if cardiac muscles are damaged, then that is permanent change. We can't reverse that with the help of these injections also. So it is always better to go for prevention of this disease, better than cure. So in that condition, like we are having various mineral supplements like RB Min or SC Care. So we can add these to the normal feed of the animals or sheep and goat to prevent the development of this nutritional muscular degeneration. Next is copper deficiency diseases in case of sheep and goat. Copper deficiency diseases are more common in case of sheep rather than goat. Sheep are more affected. And some common diseases like soyback or enzootic ataxia, in which mostly lambs are affected, and impaired development of CNS is there in case of fetus, and they will not be able to walk properly. Loss of pigmentation in black wool sheep and increased incidences of fractures in long bones and rib fractures will be there. Copper deficiency will develop mostly when copper levels in plants are naturally less. Like those soils are naturally deficient in the copper. So in those areas, whichever plants are grown, they will be having less copper levels. Or induced deficiency, like copper deficiency can be there when excess of molybdenum or sulfur is there in the diet. So that can also be a reason for less copper levels. So how we can diagnose such cases, like plasma samples we can submit. In that we can check if it is concentration of less than 9.4 micromole per liter. It will indicate depletion of liver with copper reserves. And how we can prevent the disease, like in some places some injections are there, like copper guard injection is there. We can use it in sheep and goat also, like copper glycinate, copper heptonate is there. And if we are not having that, better to prevent the disease, like one application of zero 0.8 to 2.5 kg per hectare of copper, it will be sufficient for 8 years. like up to 8 years, we need not to go for any other treatment. And better we can provide multi-mineral blocks so that animal can lick the blocks ad libitum, or we can add copper containing mineral mixtures. We can add that to the diet of the animals, so that we can do to prevent the disease, copper deficiency diseases in animals. Next is acidosis or grain overload. Although somewhat we have already covered in polyencephalomalacia. So what happens? Excessive amount of grain starch or pellets when they are fed to the animals. For example, when we are introducing some new concentrate feed, or we are giving in excess, or it is mostly seen when there is some after some ceremony, like some functions, leftover food, like it can be in the form of rice or roti, when that is fed to the animals, that will lead to excess of carbohydrate concentration or starch in the rumen of the animals. And those animals which are provided no access to the roughage of an effective fiber length. Why roughage? Because roughage will lead, when they will chew the roughage, it will lead to production of saliva. And in saliva also some buffers are released. They will neutralize the acidity. So when roughage is not fed, that is another reason, like animals will develop more acidosis. And some predisposing factors, like animals which are having good appetite, they are having good body weight, they can consume more. Like when we are providing excess of some feed, so they can consume more. Or the animals which are hungry for a prolonged period or in competition, like seeing each other, they will consume more. In this picture we can see, like when there is grain overload, there will be a reduction in the number of gram negative bacteria which is actually present in the rumen. On the other hand, gram positive bacteria will increase, which will lead to the excess production of lactic acid and volatile fatty acids. When the rumen pH will decrease further and it will go to less than 5, it will destroy the protozoa and cellulitic organisms and lactate utilizing organisms which are naturally present in the rumen. Ultimately, it will impair the motility of rumen. The motility will slow down, and low pH will also allow the lactobacilli to utilize excess of carbohydrate and produce excessive lactic acid, which increases osmotic pressure, and excess of water will be drawn from the extracellular fluid into the rumen, which will lead to dehydration in the body. On the other hand, what it will do, like lactic acid, that will um, um, damage the local mucosa of the rumen. Ultimately, due to that increased oncotic pressure, there will be development of diarrhea. And that low rumen pH will also lead to chemical rumenitis and acidemia when that is taken up into the blood system. So these are the affections which are seen due to acidosis. Clinical findings, like in acute cases, mostly we will see animal is dead. Like if animal has consumed excess of carbohydrate, within few hours animal can die. And decreased human movements can be there, bloat can be there, and stargazing postures can be there in the affected animals. That may be due to thiamine deficiency, because thiamine is also produced in rumen, and in acidosis those bacteria are reduced. Survivors, if those animals which are surviving in this disease, sometimes they will lead to permanent damage to the lining of rumen, and they will be poor doers. Like although they will survive, but they will not properly absorb the nutrients for rest of their life. Another important part is subacute ruminal acidosis, which is also known as SARA. So it is more difficult to recognize as compared to acute acidosis, and because animals will be taking food, but less intake will be there, and there will be reduction in the performance of the affecting animals. Animals can sometimes reduce show like reduced cud chewing, kicking at the belly. Sometimes diarrhea can be there, and in chronic cases there can be development of laminitis. Coming to diagnosis, like we can go for a collection of rumen liquor. We can check the pH. Normally the pH is 6, in between 6.4 to 6.8, but if it is more than 5.9, that also we will consider like it can be normal in some cases. Clinical findings, like if bloat is there, or animal is showing some CNS signs, stargazing posture, or kicking at the belly, so we can go for examination of the history, like what was fed to the animal. animal. If diarrhea is there, that diarrhea will be of bubbly consistency. And bubbly means digestion of the feed is less, and it has fermented for long time in the intestine. So that can be seen if some animal is dying in that post-mortem. We can say rumen distended with palates and fluid. Differential diagnosis we should do with salmonellosis, gastrointestinal accidents, enterotoxemia, as well as bloat. Coming to the treatment, initially we can go for infusion of alkalizing agents like in IV fluid. Also, we can go for sodium bicarbonate, or we can give Ringer's lactate solution. If orally we are giving like blotarate or blotosil, we can give because that is having magnesium hydroxide also. Fluid therapy, administering antibiotics like gram-positive bacteria are more, so better to go for penicillins or antibiotics which are acting on gram-positive bacteria. Anti-inflammatory drugs we can give. Ruminal cut transfer, if possible, like we can go for to some slaughterhouse. We can collect from there ruminal cut. We can transfer to the animal by drenching, or if we are having other fellow animals, we can collect from them and transfer to the animal, and it increase the intake of roughages so that more saliva will be produced and more time will be there for production of thiamine in the rumen. And for coming to prevention, we can prevent the disease by regular feeding of palatable roughage, introducing animals to higher carbohydrates slowly, like in small quantity. We can increase day by day. We should not grind the grains means completely, like we should not make the flour out of it. We can give half grind grains also. Inophores or buffers like buff zone if it is present, or inophores like bovatec which is having losalosid, rumensin, if that is available, we can feed the animal to increase their production or promote rumen functions. Coming to the last disease for today, that is bloat or ruminal tympany. Introduction, like over distension of the rumen with gases of fermentation like methane, hydrogen, carbon dioxide, which are produced. Like normally what happens, gases which are produced, they are eructated through oral or through anus. But when there is failure of eructation, it will lead to bloat. Bloat means excess of pressure will be there, more pressure in the rumen. So it can be of two types. First one is primary bloat, also known as frothy or foamy bloat, which is due to give pasture or feedlot bloat, it is known as. And second is when second type secondary bloat, in which foam is not present, that is due to free gas bloat. Like in cases when choke is there, for example, this picture animal is taking a carrot. If something carrot, some potato, something is stuck inside, or there is some tumorous growth or something which is pressing on the lumen of the esophagus. So in those cases, there can be failure of eructation of free gas leading to secondary bloat. In legume pastures, when animal is on legume pasture which are having high concentration of protein, like plants specifically which are in vegetative state or early bud stage, which are fed to the animals, so there will be production of excess of foam will be produced in those cases, and that will lead to the means trapping of the gas, and those small gas bubbles will not be able to coalesce, because soluble leaf proteins, saponins, hemicellulose are primary foaming agents, and salivary mucin is anti-foaming. Means if saliva is produced, that will be anti-foaming agent. But when animals are fed on succulent pastures, already that is having high concentration of fluid, so animal will produce less saliva. So as a result, there are high chances of production of bloat in those animals. And bloat producing pastures like alfalfa, they are more easily digested and may release a great amount of small chloroplast particles that can trap the gas molecules. And so we should give some other pastures. We can also grow some plants like fenugreek is there, which is having less content of proteins. So we can feed that along with the alfalfa to the affected animals. Clinical findings like distension of left side of abdomen, or in severe cases, right side can also be distended. Drum thumping sound when we are doing percussion in the paralumbar area. Skin tenting will be difficult. in the affected area. Animal will show anorexia, dyspnea due to increased pressure on the diaphragm, grunting, open mouth breathing, pain, discomfort will be there. Animal will try to kick on the abdomen, bellowing will be there, respiratory distress, ultimately leading to the death of affected animals in severe cases. Diagnosis like history of feeding, clinical signs, rapid correction of bloat in case of free gas bloat, or in primary bloat when antifoaming agents are given, after some time only animal will show recovery. And coming to the management, like we should encourage walking. Like due to walking, if sometimes animal can irritate the gas, that will give some relief to the animal. In case of frothy bloat, we can give antifoaming agents like orally we can give mineral oils orally, or like Lotosil is there, we can, which is having simethicone, dimethicone as antifoaming agent, which are reducing the surface tension and not letting the froth to form. We can give orally as well as intraruminally also if it is needed. And in free gas bloat, rumen fistula, or we can remove an esophageal obstruction if it is possible, or we should go for rheumatectomy. For example, in this picture, they are trying to put the stomach tube. Like if that is possible, that can serve the purpose, we can go for that. And polozellin, that is another non-ionic surfactant, which can be given in case of leguminous bloat only, not in case of feedlot bloat, because it will not let the foam to form. But in feedlot bloat, there is not much foam formation, so we should give only in legume bloat. And prevention, like feeding hay before pasture giving, or we can give grow the pastures like in which plants which are having more protein like alfalfa can be grown along with plants which are having less protein like fenugreek is there, we can grow along with that. So this is all about bloat, and how we can prevent the nutrition diseases in general in animals. Like we have to give balanced ration feeding, gradual feed changes, like slowly we can change the feed. Adequate roughage should be fed to the animals. We should maintain the body condition score, like in between 2 to 4. Animals should not be more thin or more fat. And we should provide exercise and proper sun exposure for proper calcium absorption in the body. So this is all for the presentation. Thank you everyone for your attention.